Have you ever reached that moment of climax and realized nothing came out? You felt the sensation, the intensity, maybe even the satisfaction, but when you looked down, there was no release, just silence where you expected something more. If that's ever happened to you, I want you to know something right away. You're not broken, you're not alone, and more importantly, this is something we can talk about openly without shame or fear. As a doctor who spent years working with men just like you, especially those over 50, I want to walk you through what's really going on here because while it may feel alarming at first, this experience called retrograde ejaculation is actually much more common than you might think. And more often than not, it's not dangerous, it's just different. Here's the truth. When you orgasm and nothing is released, it usually means that the semen didn't exit through the penis the way it's supposed to. Instead, it flowed backward into your bladder. Yes, into the bladder. So while it may feel like there's no ejaculation happening at all, what's really happening is that the fluid is taking a different route. It's still there, it just didn't go where you expected. You might notice that the next time you urinate, your urine looks cloudy. That's because the semen has mixed with your urine and is now exiting your body that way. It's not painful, it's not dangerous, but it can be confusing if you don't understand it. Now, you might be wondering, why does this happen? Why now? Why me? One of the main reasons has to do with age. As we get older, the nerves and muscles that control ejaculation may not function as efficiently. Think of it like a finely tuned orchestra. In your younger years, everything was synchronized. Every muscle, every nerve, every valve knew exactly when to act. But over time, that coordination can fade. The muscles at the base of your bladder, which are supposed to close off during orgasm to keep semen moving forward, might weaken or misfire. When that happens, the semen simply goes the other way. But age alone isn't the only factor. There are medications that play a big role too. If you're taking drugs for high blood pressure, depression, or an enlarged prostate, things like alpha blockers or certain antidepressants, they can affect the muscles and nerves involved in ejaculation. These medications relax the bladder neck, which sounds good for urination, but not so great when you're trying to keep semen moving in the right direction. And then there's surgeries. If you've had a procedure on your prostate, say for benign prostatic hyperplasia or even prostate cancer, some of the nerves responsible for ejaculation may have been impacted during the operation. It's not a mistake. It's just an unavoidable risk that comes with treating serious conditions. And while those surgeries can be life-saving, they can also change how your body responds to arousal and orgasm. Sometimes the cause isn't physical at all. Sometimes it's psychological. Stress, anxiety, or even a quiet sense of shame about getting older can interfere with how your body responds to sexual stimulation. The mind and the body are deeply connected, and if your brain isn't in sync with the moment, your body might not follow through the way you expect. Now, let me ask you something that might feel uncomfortable, but it's important. Have you told anyone about this? A doctor, a partner, anyone? If you haven't, you're not alone. Most men who experience retrograde ejaculation stay silent. They feel embarrassed. They worry it's a sign of weakness, or worse, that it makes them less of a man. Let me tell you something clearly, and I want you to really hear this. You are still a man. Your masculinity is not measured by whether semen shoots out during climax. It is not defined by performance, output, or mechanics. Your masculinity is measured by your character, by your courage, and by your ability to stay curious and compassionate toward your own body as it changes. Yes, retrograde ejaculation can be frustrating, especially if you're still trying to have children. And yes, it can feel strange when your body suddenly does something it's never done before. But it is not the end of your sexuality. In fact, in many ways, it can be the beginning of something deeper, a new way to connect, a new way to define intimacy. If you're concerned about fertility, there are treatments available. A doctor can help you determine whether medications might help redirect the flow or whether assisted reproductive techniques are a better fit. If your concern isn't about having children, but simply understanding what's happening, you may not need any treatment at all, just knowledge, just peace of mind. Sometimes that's all a man needs, just to know that he's not going crazy, that this doesn't mean the end of his sex life, that his partner won't reject him, that pleasure is still possible, connection is still possible, and love, real human love, isn't dependent on a perfect performance. That's something many men struggle to accept. We live in a world that teaches men their worth is tied to their strength, their productivity, their control. And when something changes, when the body becomes less predictable, it can feel like a personal failure. But let me offer you a different perspective. What if this wasn't a failure at all? What if this was just a transition, a shift in the story of your life, a reminder that intimacy is not just about physical output? It's about presence. It's about trust. It's about slowing down, breathing deeply, and being with another person without pressure or performance. I've spoken with couples in their 60s, 70s, even 80s, who tell me their sex life became more fulfilling, not less, after they stopped chasing the climax and started cherishing the connection. They found new ways to touch, new ways to laugh, new ways to be close that had nothing to do with ejaculation and everything to do with feeling seen, valued, and loved. That's the secret no one talks about. As the body changes, your relationship with sex can change too if you let it, if you're willing to step into that space with curiosity instead of shame. And if you're in a relationship, communication becomes your greatest tool. Talk to your partner. Let them know what's happening. Share your fears, your hopes, your needs. You'd be amazed how many people, especially women, aren't nearly as focused on what comes out during sex and much more focused on how connected they feel. They care about your heart, your honesty, your attention. All of that is still within your control. You haven't lost anything that truly matters. You've just arrived at a new chapter. There's something deeply empowering about knowing the truth. When you understand what's happening in your body, you stop feeling afraid of it. You stop imagining the worst case scenarios, and instead you start responding with clarity and calm. So let's talk about what you can actually do. Because even though retrograde ejaculation is usually harmless, there are times when it's worth bringing to your doctor's attention, especially if this is new for you or if it's accompanied by other symptoms like discomfort, pain, difficulty urinating, or a sudden change in your ability to get or maintain an erection. These changes might not be serious, but they're always worth checking out. You deserve to know what's going on and to feel confident in your care. If you're still sexually active and not worried about fertility, you may choose not to treat this at all. But if you're bothered by it, physically or emotionally, there are options to explore. Sometimes a simple change in medication can make a difference. If a particular drug is relaxing the bladder neck too much, your doctor might be able to adjust your prescription or recommend an alternative. There are also medications that stimulate the muscles responsible for ejaculation, helping the semen go in the right direction. These aren't guaranteed to work for everyone, but for some men, they provide just enough support to restore a more typical ejaculation. And if you're hoping to father a child, there are fertility specialists who can help retrieve sperm from your urine for use in assisted reproductive techniques. It may sound strange, but it's safe, effective, and has helped many couples start families later in life. Beyond the medical side, there's the emotional piece. Because let's be honest, anytime something changes in how you function sexually, it can shake your confidence. You might feel embarrassed, less desirable, or unsure of how to explain it to a partner. But the truth is, how you approach this moment can either build connection or create distance. And that choice is in your hands. Many men have told me they initially felt humiliated when this first happened. They thought something was broken, that they'd lost their masculinity, or that their partner would notice and be disappointed. But what they discovered once they opened up was something very different. They found understanding, compassion, and in many cases, a deeper intimacy than they'd had in years. Because when you share something vulnerable with your partner, you're not just talking about biology. You're inviting them into your world. You're saying, this is where I am right now. I want to walk through this with you, not hide from it. And for many couples, that moment becomes a turning point, not just in the bedroom, but in the relationship as a whole. You might even find, as others have, that sex becomes more meaningful once it's no longer centered on ejaculation. That might sound counterintuitive, but think about it. If you've spent decades focusing on performance, pressure, or the destination, this could be your invitation to rediscover the journey, to explore slower, more sensual forms of touch, to talk more, to laugh more, to remember what it feels like to simply be close. There's no one right way to be intimate, no formula, no finish line you're supposed to cross. What matters is how present you are, how attentive, how emotionally open. Those are the qualities that create lasting pleasure, not just physical, but emotional too. And sometimes this experience, this dry ejaculation, can be the very thing that brings all of that into focus. Now, let's talk briefly about something that doesn't get enough attention. The way culture treats male sexual health, especially in older men, is often filled with silence or ridicule. There's this unspoken rule that you're not supposed to talk about it, that if your body changes, you should just deal with it quietly, or worse, pretend it's not happening. And that silence, it creates shame, it keeps people isolated, and it stops them from seeking help that could actually make a difference. But imagine if we did the opposite. Imagine if you told a friend, hey, has this ever happened to you? Imagine if we normalized the fact that our bodies evolve, that it's not something to hide, but something to understand. We do that with other parts of aging. We talk about joint pain, memory lapses, eyesight changes. Why not sexual function? The more you understand this part of your health, the more you take back control. You stop feeling at the mercy of something strange and unknown, and instead you realize this is just one of many natural shifts that can happen over time. It's not a crisis. It's not a character flaw. It's simply a signal, a nudge to pay attention and maybe adjust your expectations or routines. If you've ever felt pressure to hide what's going on, please hear this. You don't have to pretend. You don't have to explain yourself, and you certainly don't have to apologize. You're allowed to feel confused. You're allowed to feel frustrated, but you're also allowed to feel peace, relief, even gratitude that your body, in all its complexity, is still capable of pleasure, connection, and change. And sometimes the most loving thing you can do for yourself and for the people who care about you is to be honest about what's really going on, to say, this is happening. I don't fully understand it yet, but I want to learn. I want to adapt. I want to keep growing. Because the truth is, growth doesn't stop at 60 or 70 or 80. It keeps going. As long as you're alive, your body will change. So will your mind, your relationships, your needs. And every single one of those changes is an invitation to get closer to who you really are, not who you were 20 years ago, but who you are now. So if you've experienced retrograde ejaculation, you're not broken. You're not less of a man. You're simply in a new phase, a phase that deserves understanding, not shame, support, not silence, intimacy, not isolation. You're not alone in this. You are not alone. You might not have planned for this part of aging. It's not something they talk about in commercials for retirement or mention at the doctor's office unless you ask first, but that doesn't mean it has to catch you off guard. The truth is, getting older doesn't mean losing your sexuality. It just means learning to meet it where it is now, and that can be a beautiful, liberating shift if you're willing to embrace it. There's a quiet dignity in adapting with grace. When you no longer measure your worth by performance alone, you open yourself up to something much deeper. Maybe you don't chase the same highs you did when you were 25, but what you gain now is presence, intention, an awareness that intimacy is no longer about proving anything. It's about being seen and seeing someone else without all the noise. That's not a downgrade. That's an upgrade most people never reach. You don't have to rush. You don't have to fix. You just have to listen to your body, to your partner, to what's happening beneath the surface of silence. And when you do, when you stop trying to control or correct what your body is doing, you might find that something incredible happens. You begin to trust yourself again. And this is where healing begins, not just in your body, but in how you relate to it. You stop blaming it for changing. You stop mourning what used to be, and instead you begin asking different questions. Not why can't I, but what do I want now? Not what's missing, but what still feels good. Because the answer to that second question, that's where your life lives now. So many men reach this stage thinking the best is behind them, but it isn't, not by a long shot. This is a time when clarity becomes easier, when connection becomes richer, when love, when handled with care, becomes less about the body and more about the soul. I've seen it firsthand. Men who thought their sex life was over because something changed. But when they stopped hiding, when they got curious instead of ashamed, they rediscovered parts of themselves they hadn't touched in years. They stopped focusing on the outcome and started focusing on the experience. They learn to slow down, to communicate, to breathe together with someone else. They learn that climax is just one part of the story, and not even the most important part. You might be surprised to hear this from a doctor, but I believe science and emotion go hand in hand. Understanding your body is essential, yes, but honoring how you feel about those changes is just as important. That's where the true medicine lies, in your willingness to be honest, to ask for support, to stop suffering in silence because someone somewhere told you to be tough and quiet. You don't have to be quiet anymore. It takes strength to say, I need help understanding what's happening. It takes wisdom to realize that your needs have changed. And it takes courage to keep showing up, to keep seeking closeness, even when things don't look or feel like they used to. But that's what love is. That's what intimacy becomes in this stage of life. A quiet rebellion against shame, a gentle reclamation of your body and your right to feel good in it, exactly as you are now. You may find that the conversations you have from this point forward are more real. You may discover that when you're no longer trying to impress or perform, there's more laughter in the bedroom, more tenderness, more moments that feel like deep exhalations after years of holding it all in. And if you're alone right now, if you're not in a relationship, that doesn't make this conversation any less important, because your relationship with your own body is still sacred. Your pleasure still matters. Your ability to feel connection, whether with someone else or within yourself, is still alive and valid. You don't have to wait for the perfect moment or the perfect partner to start embracing this part of yourself again. You just have to give yourself permission. No one teaches us how to grow older in this area, but I hope just by listening to this, you've started to feel a shift. Maybe a little more understanding, maybe a little less shame, maybe a bit more compassion for what your body is going through and all it has carried you through already. Retrograde ejaculation might have caught you off guard. It might have made you feel uncertain or even disappointed, but now you know. Now you understand the how and the why, and more importantly, you understand that it doesn't have to be a barrier to your intimacy or your joy. It's just one part of a much bigger picture. Your story didn't end when things changed. It simply entered a new chapter, one filled with softer edges, quieter beauty, and the kind of truth that only comes with age. So let go of the old definitions, release the pressure, stop waiting to feel like your younger self again, because the man you are now, the man with experience, depth, and perspective, is more than enough, and in many ways, he's just getting started. Let your relationships evolve. Let your understanding of pleasure deepen. Let your body be exactly what it is without apology. You've earned that freedom. You've earned that peace. And if you ever find yourself doubting that, I hope you'll come back to this moment, to this conversation, to the reminder that what's happening to you is normal, manageable, and even meaningful.